Well, Hong Kong will invoke an emergency law to allow mainland Chinese doctors and nurses help in the city's fight a worsening crisis in its fifth COVID-19 wave. Now, medics from across the border haven't been allowed to treat patients in the city without a local license, but with cases mounting to another record high of more than 8,000 infections, there's a growing need for more manpower in the city. The government has rolled out a new vaccine pass to enter most venues, but as Deborah Wong finds out, not everyone is on board with the move.
Scan, check in, go. This is the new reality that Hong Kong residents must get used to if they want to enter places like malls, schools and markets.
Little cumbersome, but yeah, it's okay. For the safety, I would go for it.
But under the shadow of the controversial national security law that was passed in June 2020, privacy and trust remained a real concern among the locals. Authorities have constantly assured residents that vaccine information is protected and data will be raised after 31 days. Even so,
I mean, the government is looking at what you are going at each day, so I don't like it.
As we all know that the virus is everywhere, so it's no point to know where did the infected people go.
Hong Kong's vaccine pass is similar to what other countries have rolled out to drive up vaccination rates. It's reliant on the contact tracing app called the Leave Home Safe app, which stores the user's vaccination records. But visitors may also present a printed form of the vaccination status if they don't own a smartphone. Well, convenient for the most part, social workers tell me a different story.
Impact HK helps street sleepers, many of whom need access to public amenities like government buildings for social assistance, or even malls to do their daily wash-up.
Obviously, one of the issues when you're living on the streets is that you don't have a base, you don't have a secure place for your items. It's very easy to misplace something, and if it's a one-time piece of paper, re-accessing that QR code or that data is going to be really hard. Look at the weather we've been having in the last week. If you sleep outside and your items are all totally drenched, you're soaking wet through, that piece of paper isn't going to last long.
Impact HK is working with donors to provide the needy with smartphones. It's also teaching those who are digitally illiterate how to navigate the app. But another NGO says the problem of getting the marginalized on board runs deeper.
They do not like to get vaccinated. 90% of the people we work with are drug addicts. They believe that drugs is better than Pfizer. So among the 100 street sleepers under our radar, so far we have record of 3 persons got confirmed. They went into the government's shelter to use beds and get instant noodles. And at the entrance, they checked out that they got COVID. So they just walked away.
So his team is doing what they can to continue outreach, providing blankets and food to those who can't access the necessary services. And NGOs are urging the government to do more for those who fall through the city's social safety net. While work is underway for the mass COVID testing of its 7.4 million population next month, health authorities are ramping up efforts to raise the vaccination rates in the city. All Hong Kong residents will eventually have to get 3 doses of the vaccine by June to be considered fully vaccinated. Deborah Wong, CNA, Hong Kong.